todo tuyo. Cógelo.
Thank you, sir.
Cuando lo cojas, puedes venir para atrás, coger pan y leche y watermelon.
Do you want bread? Okay. There's bagels. There's all different types of bread. That's good? Okay.
Okay, ready?
All ready? I'm gonna help you outside. You carry that little one. Kat, can you grab the door?
Thank you very much.
You're welcome. I hope you feel better.
We are the largest anti-hunger organization in Passaic County, even in terms of physical space. We have a 28,000 square foot facility right in downtown Patterson, and we serve about 50,000 people a year and roughly about 65 different nonprofits and partner organizations. CUMAC was, for a long time, pumping out millions of pounds of food, and it was great. But it was already fast-paced, and that was before the pandemic. By mid-February, we were watching the news and we were thinking to ourselves, this is going to get bad. It wasn't just seeing the writing on the wall, the numbers, the cases were really in our face.
Worldwide this morning, growing concern over a growing health crisis.
After shattering another record for daily infections, tonight more Americans than ever are hospitalized with COVID.
We saw that 20% of the workforce in those first 2 months of March and April had lost their jobs. There has been such a financial and economic impact of COVID on our economy, and that will have long-lasting ripple effects.
Millions of Americans who lost part or all of their income due to the coronavirus pandemic are facing eviction as the deadly virus continues to spread across the U.S.
Before the pandemic, basically I was just like hustle, bustle, do what you have to do to make ends meet, but it was never as severe as like once March hit, it was like everything just shut down.
Many jobs have been lost, and they've really had to depend upon food pantries to survive.
The phone started ringing more off the hook with people saying, I've never had to do this before, I need help.
Right away they tell us, this is our first time, we just lost our job.
It's needed because so many people are not working. Right. A lot of my friends, we worked together 20 and 30 years and now we're not working.
I came here because I lost my job. I became disabled. This was my last resort because I was desperate.
My last job was March, and not making the same amount of money, having a family of 4, thinking what's going to happen next, where are we going to get the food from?
Tenemos que trabajar, tenemos que buscar para pagar la renta, para la comida, para todo, para los biles.
What initially brought you here?
The pandemic. I lost my job. So this has been helpful.
One of the first concerns, in addition to the working poor and to other adults in hunger, was children. We know a lot of low-income children have school meals be their primary source of nutrition. And with COVID happening and schools closing, people going to remote learning and learning from home, that was a big concern.
Pre-COVID, everything down across and over would turn, 90% of it would turn over every 30 days to serve our communities. Right now, where we are, we're turning this over probably every 2 weeks. It comes in and it goes out.
We saw an unprecedented level of demand in our region, and our food bank distributed in the month of March 300% more than we did in March 2019. And the numbers of people that had been coming to our network for assistance had doubled.
3.3 million more meals out of this facility than we did same time period the year before. Right now, I know a lot of our clients are working one job, but the family had 2 or 3 jobs. So they're still in crisis, and they're running to keep up. And without food stamps, without affordable care, without utility help, without mortgage help, without foreclosure help, they're going to get so far behind they'll never be able to crawl out.
Their cars parked bumper to bumper in a vast San Antonio parking lot, waiting for food.
Look at these lines.
That is the stark reality of this pandemic.
Feeding America projecting more than 50 million people will face food insecurity this year, 15 million more than last year.
Welcome everyone. I am Chef Jose Andres. I'm going to show you how to make a terrible dish we serve up in America every day. Recipe for food insecurity. Already simmering in the pot is systemic racism, healthcare disparities, low wages and living paycheck to paycheck, high cost of living, past failures of government policy, toxic stress and food deserts. When then add a tiny bit of nutrition, but never quite enough. With this, we fold in wages that cannot keep up with rising costs of housing, health, and so much more. Wow, things are really heating up. A helping of food supply chain issues, an increase of grocery prices, and some physical and mental health issues. And there you have it, food insecurity in America.
Hi, I'm Margaret Higgins. I'm from East Rockaway, New York, Long Island. I was actually freelancing at the time. So I was traveling to people's homes. I had a whole clientele base. And then once everything shut down, that was it. Knowing that I wasn't having any income, because once it stopped, it stopped. There was no money coming in. I went from one extreme to the other. So I knew, I'm like, how am I gonna feed my kids? How am I gonna pay my bills? It was scary. It just all hit at once. And then I was reaching out to local churches, trying to get help. It was really hard, it was scary. It kind of made me feel like I wasn't able to do what I was supposed to as a mom, to make sure my kids were fed. And that's like the one thing how can I not be able to make sure my kids are fed and have a roof over their head? I just felt like lost. I didn't even know if defeated. Like, what do I do now?
So go ahead and put one of those in there, and put this box in there, and that'll be Ellie's one.
That's two of each of what's there.
Get sorted out for the people for later.
Okay.
Because they're not home right now, so.
All right.
Okay.
So it's what, 3 peoples?
Yeah, there's 3 more people here. And we'll take it down there, we'll put the perishable stuff and everything in my refrigerator until they get home, and then we can deliver to them later. Well, my name is Jill Marshall. You're at Spring Meadow Apartments, which is a housing complex for seniors and handicapped people in Bath, New York. Everybody that lives here is on a fixed income, and the food insecurity has made it even rougher for people like us. We were already struggling before the pandemic hit. The pandemic has emphasized the problem. And a lot of the seniors here, they help out their kids, their grandkids, so there's not a lot of money left over for them either, or food. There's times that people have had to choose between getting their medication or buying food. And that's a very hard decision for people to make. There's a lot of people here that have a lot of health problems, that they've got to have their medication. So how do you choose? Before we started getting deliveries from the food bank, a lot of people struggled with it because they don't have a vehicle. People need to understand that people that are on a fixed limited income struggle a lot more. You know, I'm on SSI. I live on less than $800 a month. That doesn't go very far. We don't get a pay raise every year like our Congress does or our senators do. You know, they don't have to worry about food insecurity. They don't have to worry about paying their bills. They don't have to worry about being able to feed their family. People here do. And that's a real problem for people.
Income inequality was already a major problem before COVID. The Federal Reserve conducted a study before the pandemic showing that 40% of Americans would have a difficult time having an unexpected $400 bill. So imagine many of those folks were really just living paycheck to paycheck, and then all of a sudden are out of a job, have their hours cut, some kind of job disruption. Definitely made situations worse for people who were already vulnerable. Racial injustices and systemic inequalities make it much more difficult for certain groups of people, and especially people of color, to get ahead and to be able to afford and access healthy food.
What's not being told is that this is not touching just one area of society. Insecurity, as I said before, that's always been around. People have always had issues. But now, because of the pandemic, it's opened a door so people can see that other people have issues. So you can't just put it on one population or one area of the country. It's everywhere. It's global. And so people have to understand that. And I'm hoping that people will at least take away from this tragic situation that, you know what, we're in this together.
America does not know food insecurity during this pandemic. What America knows is that people need food and families need food, and especially Black and brown communities need food. That's what America knows, and that's what America sees on the news. Food insecurity is, I have to choose between food and rent. I have to choose between food and paying for school or getting my kids to school. I have to choose between my car that I need to get to work and getting groceries. I don't think America really knows that. And the reason I say that is because America still wants to throw emergency food at families.
I think the number one thing that people need to know about food insecurity is that we've always had it. And when food banking first started, it was like, oh, this is a temporary thing that we're gonna do for a little while, and then we'll figure it out, like we'll end hunger. And if anything, food banks have grown and grown and grown, and hunger has not really gone away. I think COVID has, again, magnified some of those underlying issues that were present before, but now, you know, they're obvious, they're in everyone's face.
Media coverage of hunger and poverty in America goes up and down. There was a massive amount of coverage in the late 1960s that also focused on the need for government to do more. That media coverage in the 1960s really significantly drove public policy change. In fact, in 1968, CBS News had a 50-minute primetime special on hunger in America that really captivated the public's attention and really forced Congress and the Nixon White House in the next few months to take action.
CBS News has spent the last 10 months investigating hunger in America. A quarter of San Antonio's Mexican Americans, 100,000 people, are hungry all the time. The families we have visited tonight are sadly more typical than unique. Hunger can be found many places in the United States.
Most years since the 1960s, there's been virtually no coverage of hunger in America in the major national media. It spikes a little when there's an economic collapse and the elites are in trouble. So you saw a spike in hunger coverage during the beginning of the Reagan recession. You saw a spike in the hunger coverage after the collapse of the economy in 2008 and 2009. And you saw a massive amount of coverage after the pandemic because frankly, the people who own the media, you know, the high-priced editors and publishers, they had friends who were worried about their economic well-being, so they said, aha, this is a problem. But as soon as we go back to plain old vanilla hunger and poverty, when it's merely tens of millions of Americans struggling to afford enough food who the publishers and editors don't know, all of a sudden hunger drops out of the discussion whatsoever.
This was always supposed to be about justice, and what this pandemic has taught us is that we were not just, and we were not equitable, and we were not calling out the systems that were perpetuating this cycle of millions of Americans living on the precipice of food insecurity.
I really just want people to know that while the food bank, our food bank, and other food banks across the country have done incredible work, really ramping up, doing what we can to get food in the building, to get food out into the hands of people who need it, to continue to find innovative ways. It's no substitute for a strong economy, for government interventions, for a strong social safety net, for all these things that actually do more than we can ever do.
So it's pretty much just like Black Lives, that movement. It's having conversations and not being afraid, to have those conversations and say, we need change.
People think you can't make change, and that's just wrong. We used to have child labor in this country, and people thought it was just the way it is. There's nothing you can do to change it. It's inevitable. We used to have slavery in this country. We still have horrible conditions on racial disparities, but we ended legal slavery. We ensured that women have the right to vote. We guaranteed marriage equity in this country. All of those victories came about because of social movements. And we almost ended hunger in America in the 1970s because a social movement launched by Dr. Martin Luther King and continued after his death by Reverend Ralph Abernathy through the Poor People's Campaign pushed for the creation of the modern nutrition safety net, which almost entirely ended hunger before we started going backwards in the Reagan era. So history proves that social movements can end big social problems. So history proves that grassroots activism can get our elected officials to end hunger in America.